Hello everyone. Today we are going to see a video on biomedical signal processing. Biomedical signal processing is a bridge of engineering and healthcare. Our body continuously generating signals like heartbeat, brain activity, muscle movement. Biomedical signal processing is a science of capturing these signals, removing noise, and it is used for healthcare diagnosis. Think about the ECG monitor. Your heart and ECG tracking bradycardia for epilepsy. These tools rely on processing on raw noisy signals in means doctor cannot be understand the signals. By using the biomedical signal processing, we can convert these signals into uh, easily trackable and it for medical records. The field combine maths, engineering, and biology to improve the diagnosis, monitoring the patient, and health issues. So stay tuned as we are exploring how biomedical signal processing is transformed in life every days.
Now we see about what we learn in biomedical signal processing. In biomedical signal processing, we process and analyze the signals which are generated by our body. These signals are generated in the form of electrical activity of the heart and as well as the electrical activity of the brain. The electrical activity of the heart is generated through the ECG and the electrical activity of the brain is generated through the EEG. These ECG and EEG signals are mostly corrupted by noise which are caused by muscle movements and poor placements of sensors. These are removed by using certain adaptive algorithms and certain techniques for further use. We also study how to transform these signals into different domains such as frequency and time domain to uncover useful information. For example, in EEG analysis, different frequency bands such as alpha, beta, or theta waves can reveal whether a person is relaxed state, concentrating, or experiencing neurological issues like seizures. Similarly, frequency domain analysis of heart rate variability can provide insight into stress level and cardiovascular health. A particularly exciting aspect of this field is of integration AI/ML into biomedical signal processing. We learn how to use AI algorithms to automate tasks such as detecting heart abnormalities or classifying sleep stages from EEG signals. These algorithms are trained on large datasets to identify subtle patterns that humans might miss. This made diagnose faster and more accurate and scalable.
Now let's talk about real-life applications. Let's take a closer look at some of the real-world applications of biomedical signal processing and how it improves the healthcare. One of the most critical areas is real-time patient monitoring. For example, in an intensive care unit, it monitors continuously and analyzes the signals like ECG, blood oxygen levels, and blood pressure. Biomedical signal processing algorithms ensure these devices operate in real time, detecting irregularities like arrhythmias, hypoxia, or even early signs of cardiac arrest. Another major application is disease diagnosis. In cardiology, analyzing ECG signals helps detect arrhythmias, ischemia, or other heart disorders. In neurology, EEG is used to identify abnormal brainwave patterns for conditions like epilepsy, Alzheimer's disease, and sleep disorders. These signals are often processed automatically by algorithms, which classify them into normal or abnormal categories, saving precious time for healthcare providers. Wearable devices are another exciting area where biomedical signal processing is making an impact. Devices like fitness trackers, smartwatches, and continuous glucose monitors are equipped with sensors to track vital signals such as heart rate, blood pressure, and blood oxygen levels. Signal processing ensures these devices provide accurate and reliable data. For example, athletes use these wearables to monitor their physical performance, while patients with chronic conditions use them for preventative care. Finally, consider telemedicine, where patients in remote areas and send their biomedical details to doctors for analysis. This became especially important during COVID-19 pandemic, where face-to-face consultations were limited. Biomedical signal processing algorithms helped analyze ECG and pulse oximetry data remotely, enabling doctors to diagnose and monitor patients without requiring in-person visits. Thank you.
Now let's look at the future and emerging applications of biomedical signal processing. Biomedical signal processing is not just about current technologies, it is also paving the way for some truly revolutionary advancements. One of the most exciting developments is in the field of brain computer interfaces. BCIs allow direct communication between the brain and the external devices and enabling paralyzed patients to control prosthetic limbs or communicate via thought. This involves decoding complex neural signals and translating them into meaningful commands using advanced signal processing techniques. Another promising area is personalized medicine. By analyzing an individual's unique biomedical signals, doctors can design treatments that are specifically tailored to their genetic and physiological makeup. For example, heart rate and blood pressure signals can help predict how a patient will respond to a certain medication, reducing the risk of side effects. We are also seeing advancements in predictive healthcare. Imagine a smartwatch that doesn't just tell you your heart rate but also predicts when you might have a cardiac event based on continuous monitoring of your biomedical signals. These predictions are made possible by combining signal processing with machine learning, which identifies patterns that indicate impending health issues. Finally, biofeedback systems are emerging as powerful tools for improving mental and physical health. For instance, biofeedback devices monitor brain waves or heart rate variability in real time and provide feedback to help users manage stress, anxiety, or chronic pain. These systems rely heavily on biomedical signal processing to deliver accurate and actionable data. The future of this field is limitless, and its contributions to improving the quality of life are only growing. As technology advances, we can expect more groundbreaking innovations in healthcare driven by biomedical signal processing. In conclusion, biomedical signal processing is an incredible field that combines the power of engineering, mathematics, and biology to transform healthcare. It allows us to extract valuable insights from complex signals and use them to diagnose diseases, monitor patients, and even predict future health risks. From learning about noise removal and feature extraction to enabling applications like brain computer interfaces and personalized medicine, the field is vital to modern medicine. We hope this